Welcome back to Jersey Matters. I'm Larry Mendte. What if I told you that there was a bill in the New Jersey Assembly last year that would have helped nursing homes prepare for an outbreak just like the one we're going through? But the health department said we can't afford that. That's exactly what happened. I want you to meet the Assemblyman, Herb Conaway Jr. He's also a physician, and he is also Director of Health in Bergen County, New Jersey. Here's my interview. All right, sir, thank you so much for joining us. I hope you and your family are all doing well through this.
Yes, thank you, they are. I hope yours are doing the same.
Yeah, we are. You wear so many hats. I have so many things I want to talk to you about, but I want to start with Herb Conaway, the Assemblyman, because in 2018, there was an awful breakout at the Wanacue Nursing Care Facility and with adenovirus, and it killed 11 children. And a year later, you sponsored legislation that would require all of the long care facilities in the state to come up with a plan, an outbreak plan. According to Politico, the health department in New Jersey watered down that plan to make it so that it wasn't mandatory for most nursing facilities. So I have a couple of questions about that. First, is that story true?
Well, I wouldn't say all bills are a collaboration of the people who are affected by them. You have the nursing home industry, you have the department that has to do the oversight, you have the legislators that are representing the interests of the people writ large. And what we came to understand and the implementation of the bill was that the department, and this shouldn't be a surprise to anyone in the scarcity that we live in, that we have a health department that doesn't have the manpower, the person power, to do what they're often tasked to do by the legislature and the governor. And so we decided to focus the bill on those areas, on those institutions that have the greatest concern, and those were the ones that do ventilator care in their institutions. Now, we didn't have the benefit of the pandemic at that time, and perhaps we could have insisted that the administration build up that regulatory oversight department within the Department of Health. And this is something that you can expect that the legislature is going to be looking very closely at as we move forward.
If your plan had been implemented the way you wanted it, the way you wrote it, we'd be much better off, right?
You know, it's difficult to say. I mean, this pandemic really is one of these, I don't know, like a 100-year flood. It's an event that, while it's predicted, you don't get a chance to run the system in a crisis. And it's one of the things I was thinking about this morning. It not even related to this interview is how do we practice doing some of the responses when the sun is shining and the roof is in great shape. We need to spend some money and some time, quite frankly, on how we manage pandemic. As an example, what do we do about ambulance services when we know that our frontline EMS will unfortunately be exposed to contagion such as this? How do we manage that process better? How do we help people stay at home? How do we keep the hospitals from being overwhelmed? We saw, really difficult circumstances for North Jersey hospitals who faced the brunt of the wave. We in South Jersey, where I am, we were able to do a little better because we were farther away from New York.
You're going to revisit this?
Yes, absolutely. And it's one of the things, and we need to revisit too, by the way, our oversight of those who operate these institutions. I do have occasion to talk to people who work in the industry, and some of them have pointed out that you have actors in this space who are not really focused on caring for patients. This is their characterization, not mine. We have yet to see. But there's a little bit too much focus on the dollars and cents than there is on the care for patients. Some of these things might have been ameliorated as well if there had been more attention and better practices in place in the institutions themselves.
Now let's put on the hat of director of the health department. The governor said the other day that this is moving south now. Have you seen that?
We did see some increased numbers a couple of weeks ago, and we're seeing I would say a trailing off from a peak that we saw 10, 14 days ago. It sort of leveled out. We saw some deaths that had doubled. Now, the numbers and scale are much different in North Jersey. When we say double numbers, we're talking about losing 10 or 12 people a day, maybe 15 at its highest. Now, on Sunday, we had no deaths.
But the hospitals down in South Jersey right now, they're not overwhelmed, right?
They're not overwhelmed now. I touch base with them regularly. Their capacities are very good. Their ERs are not overwhelmed. They have vacancies in the hospital. They have enough. They have surge capacity in the ICU bed. So things are calm now. I say that with some caution. I worry a little bit, as I guess we all must, as the economy opens up, and what impact increased socialization will have, increased economic life will have on the incidence of coronavirus disease in the community.
Where are we going over the next month or so?
Well, we need, again, to move cautiously to open up the economy, get people back to work. We need to make sure that we're monitoring very carefully what's happening with each advance to a new normal. We have to make sure that we're hiring, training the people who are going to do the contact tracing, bring in technologies that have been shown to work, whether it be by cell phone or what have you. MIT has a plan. Europe's working on a plan. I had an interview with people who had looked at contact tracing and involvement in the opioid space that might have applications here. So we are seeking to advance technology solutions. We have manpower solutions, person power solutions that will help do the contact tracing. We need compliance among the population for the rules that will need to be put in place and to be adhered to, so that we can return to normal life in a way that does not endanger all of us and does not plunge us back into a situation where another very dramatic clampdown needs to be done on the economy. We've seen this play before. We've seen it in the pandemic the early part of the last century, where some cities moved ahead. Philadelphia was one. With the Spanish flu raging, decided to have a parade. In New Orleans, they decided against that. They took a more cautious approach. Philadelphia saw, unfortunate loss of life. New Orleans was spared that, and that was a decision about moving forward too quickly and putting people at risk. We should learn that lesson, heed that lesson, and move forward as we must with appropriate caution.
Sarah, it's always a pleasure. Thank you so much for your time today.
Glad to spend time with you.
That was Assemblyman Herb Conaway Jr. from Bergen County, New Jersey. When we come back, how you can get a home test for coronavirus and a home antibody test. We'll explain when Jersey Matters comes right back.